disease is meningitis. I'm on page 830. And when you lost, I can tell by your eyes. 830, you need the book. Who do not have the book? You don't have a book. I can tell you lost. We need a green book. Huh. We need a book. Share with her. Ready? Let's go. Meningitis. What is it? Inflammation of the arachnoid and pia mater of the brain and spinal cord. It caused by bacterial or viral. Meningitis can be caused by bacterial infection or by viral. Ready? Now, number 3. What causes factors, right, that cause meningitis? Ready? Skull fractures, right? Brain, spinal surgery, sinus problem, upper respiratory infection. You keep using nasal sprays, and individuals with compromised immune system. HIV people, munkimalad. CSF analyzed to determine the diagnosis and the type of meningitis. Oh, Miss Sonia, CSF, what is that? I'm going to do a lumbar puncture to check, right, the CSF to see if it is bacterial or viral. If it's clouded, it is what? Bacterial. If it's clear, it is viral. When you have meningitis and it is bacterial, the patient will automatically have a fever. When it's viral, you'll see on the patient's chest, the patient have little red mark. Petit dot, le petit eye all over the chest. Now, so CSF is analyzed, cerebral spinal fluid. Who's going to do it? The physician. How are they going to do it? A lumbar puncture. So you know that's a diagnostic test. Stay with me. So before the patient go do lumbar puncture, there's a teaching that must occur. Those are the questions NCLEX going to ask you. And we'll talk about that lumbar puncture in a minute. Now, transmission. Meningitis, you can spread it. It is ready, droplet and contact. Droplet and contact. Okay, Miss Sonia, what does that mean? When the patient has meningitis, right, the nurse will dress gown, glove, and regular mask. Regular or surgical mask. Now, because meningitis, the mortality, you guys know what mortality means, death, is high. When a patient comes into the ER and you suspect the patient had meningitis, you automatically isolate the patient. Now, you isolate the patient, meaning put the patient in a private room, right? And do a culture. Again, when you suspect the patient with meningitis. Okay, Miss Sonia, what is the assessment to know that the patient may have meningitis? Well, fever, if you have high fever, it can be anything. So fever is not the main assessment for meningitis. Here it is. If the person, a big individual, an adult, suspected of having meningitis, there's chairs over there, you will see the individual come to the ER like this, which is called mucorigidity. You will not use the fever as a mean to isolate people. Because people come with fever, that don't mean you got meningitis. Kua, the patient come in the ER with what we call nuchal rigidity. When the patient come with this, like this, automatically the nurse isolate. Once you isolate, so here's the order. I don't know if meningitis, all I saw, Kua, I isolate. The first thing, isolation. The second thing, I will do a culture. Either nose culture, which is a skill. You need to know how to do a nose culture, which I'll put all the neuro skills on the board before you leave today. Please, Tom, remind me. So, you will do, the doctor will tell you what kind of culture. And a lot of time with meningitis, they do blood, and they do nose, and then they'll do the lumbar puncture later. But they need something quick. So the doctor will say, son, you'll go do a culture. Whatever culture he ordered, I go and do. So I isolate the patient, I do culture. The culture goes to the lab. That's my job as the nurse. The doctor's job is to give this patient antibiotics, which we call broad spectrum. These antibiotics cure everything. Because remember, we don't know what type of meningitis. We don't know if the lady is bacterial. We don't know if the lady is viral. All we know, the lady came in with nuchal rigidity. So as a nurse, I isolate, I do culture, the doctor ordered antibiotic. Okay. Now, culture normally takes 72 hours to come back. So for the 3 days, the lady in droplet and contact isolation. Now, when the culture comes back, and suppose the culture say the lady had bacterial meningitis, beta hemolytic streptococcus, whatever, gram rod sidam, the doctor ordered the correct antibiotic for that bacteria. So remember, at first we gave the lady a antibiotic. When the result comes back, tell the doctor which infection, bacteria, now the doctor ordered the proper antibiotic. Let's say Cipro. So I go in, I give the lady male Cipro because that's the proper antibiotic. Now, NCLEX asks you, when does the lady come out of isolation? The lady come out of isolation after 24 hours of being on the Cipro. The correct one. You got that? Any question? We cool on that. So I told you your role as a nurse. When you suspect the patient with meningitis, you isolate that. We got it? Now, so we talked about transmission. I want you to go to C, data collection. Now, data collection. Or y'all say sign and symptoms, whatever. Anytime a patient has meningitis, these are the things you see. So I'm right here with you. I'm on what? Side effects. Stay with me with Kote Makwala for. Stay with me. Side effects. I will see, not everybody, show the same thing. I will see, ready? Mild lethargy or photophobia. Now, photophobia, eye problem. NCLEX don't have to put photophobia. They can say the patient have nystagmus. Nystagmus is an eye problem, involuntary eye movement. Pas beaucoup do photophobia. The people don't have to put photophobia. If they put nystagmus, you must know that's the same thing. Eye problem. They can put photophobia, they can put eye problem, they can put nystagmus, they can say diplopia, whatever eye problem, you're not going to see the exact word. Right? The patient have level of conscious issue. Now, there's two assessment. Oh, bon Dieu. Two assessment. This two assessment, it's not two assessment that say, yes, my lead have it. It is just a tool. Y'all know what a tool means? It is just a tool to use. It is not the tool that we used to say, yes, my lead got meningitis. It is two assessment. It is called Brudzinski and Kerning sign. You're going to go to page, you're going to go to 803. Okay, 803. Don't change this. Put a pen. Wapale 803. If it's not 803, 813, but I think it's 803. 813. Wapale 813. Pardon. I need to beef up on my books. 813. Okay? Wapale na box 56-4. 813, 56-4. Right? 813. Hey, there's seats here. Guys, I need you guys to try to sit in the chairs so if the fire marshal come in that I am, because what she gonna do, she gonna count chairs to make sure the proper students that my license requires what I have. So that's why I cannot have students sit there. You okay there? Okay? Or, darling, bring a chair and you can move this computer. You can sit here. Guys, that's why I'm telling you, if you schedule for night, you got to stick to night. Because morning is very busy. I keep morning for people that live Orlando, New York. They live far. So remember, we doubling classes. We're going to have to stick to one class because it's getting very, very crazy, right? And I don't want the fire marshal come in here and tell me I'm not following rules and regulations on what my license requires me to have. If a Sodelia, both chairs, it should be a chair that goes here. I'll move the computers and make those desks so y'all can have seats. Oh, Chris, a blue and white. Okay, there's a chair. I thought I saw. Yes, so you can sit there. I thought I saw a chair. So that's it, right? Okay. All right. So let's continue. Look at Brudzinski and Kerning. I want you to highlight it. Box 56-4. Listen, you remember when the patient have DVT and they say check for Homan sign? And I tell the students Homan sign is not the true. Homan sign is only an assessment. Kerning sign and Brudzinski sign is only an assessment. It is not the true assessment that say you got meningitis, right? Now, guess what NCLEX do? They want to know, do you know the difference between Brudzinski and Kerning? So let's go. Kerning, let's read that first. Kerning, flexion of the thigh and knee to right angle, right, when the limbs are extended. It causes spasm or hamstring pain. Kerning sign. Brudzinski, flexion of the head causing flexion of both thighs at the hip and the knee flexion. You see Kerning? You see where it says right angle? NCLEX, they put 90 degrees. Right angle, 90 degrees. C'est même chanté. So if you don't understand that, you need to know when Brzezinski is used, you need to know when Kernig is used, and you need to know the difference. This is an assessment that the nurse will do on the patient, not to confirm their meningitis, but just to see, because the true confirmation of meningitis is lumbar puncture. Any question? Make sure you know that. You got it? So everybody know Brzezinski Kerning sign. You know what it is, you know when it's used, and you know the difference between Brzezinski and Kerning. Okay. Let's go back to meningitis. So, number 4, red macular rash on the chest, and the patient will have abdomen and chest pain with viral. I'm on page 830. Right, back to meningitis. Now, nursing intervention. So that means I'm right here, nice and neat, right here. What do you do for a patient with meningitis? Miss Sonia already told you, you isolate them. Doctor give antibiotic. If it's viral, doctor give steroids, right? Now, nursing intervention. That's where we at the bottom. Ready? Vital sign. You will do neuro check. Assess for sign of ICP, which we'll talk about. When you have ICP, the patient have what we call cushion triad. 3 things. The first sign of ICP is lost level of consciousness. The cushion triad is ready, high blood pressure, widened pulse, lower respiration. ICP. So when the patient has meningitis, the patient at risk for ICP. So here it is. NCLEX say you got 4 patients. Which patient you going to see first? Listen, I told you, early sign of ICP level of consciousness. So Cowell came in with meningitis, remember? Now Cowell say, before Cowell was talking to me really good. Now Cowell say, who are you? What is this? Where am I? Ta 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 ta. That means the meningitis went to what? The meningitis went into what? ICP. So that is what will make you call the doctor. This is why student cannot pass NCLEX. Look, I told you, the early sign of ICP level of conscience. Anytime a patient has meningitis and the patient loses conscious, that tells you the patient is in ICP. That means Kavin Kisa. God, I told you 4 patients. Which patient you gonna see first? Guess the way I put it. The patient who came in with meningitis, but asking questions. Where am I? Who am I? What is this? Who are you? Before she talked to me good, when she came in with meningitis, now she asking me who I am. What is this? That means her meningitis went into what? That means we need to call what? Do y'all see the critical thinking? And let me explain to you. When I break it down easy, you get it. Soon as I mix it, I get you. If you want to pass NCLEX, you must be able to figure out when I add the lemon juice in it, you still can understand it. I said meningitis can go to ICP. The early sign of ICP is level of conscience. If a patient comes in diagnosed with meningitis, then the patient say, where am I? Who are you? That means that meningitis patient went into ICP. I didn't say it in those words. I just flip it. I need you to increase the understanding. That is when the people say critical thinking. That is where the critical thinking. I can teach it piece by piece, and then we put it together. You got it? Mm-hmm. Okay, so let's go. Initiate seizure precaution. Now, here it is. Meningitis can go to ICP. ICP can go to seizure. Do you see NCLEX can ask you a meningitis question and stick seizure in it? And bring the Dilantin drugs that I taught you yesterday, because meningitis go ICP, ICP go to seizure. So I can ask you drugs on meningitis. I can ask you drugs on the ICP, which is mannitol, and I can ask you drugs on seizure. Do you see it? Meningitis, ICP, and then seizures. That is med-surg. You got it? Okay, continue. Perform cranial nerve assessment. We talked about that. Isolation. I already told you. What isolation? You're going to put a meningitis patient. Contact in. You go to NCLEX. Kikection. NCLEX can ask you on so far on meningitis. You get lost. Right? You cannot get lost. Now, with kids who have meningitis, children, little babies, will not have mucorrhizia. They will have that shrill cry, that funny cry. That's a sign of meningitis. That's why yesterday in test taking strategy, shrill cry is a medical what? All right. Well, on comprend, bagay yo pretty. Okay? Continuing. So we said maintain respiratory isolation. We talked about that. Elevate the head of the bed 30 degrees. Why? Stick to what? To what? ICP. Wet. Keep it smooth. ICP. Administer energistic. Yes. But which energistic we will not give? We learned that yesterday. Morphine. You know what? Keep it together. All the drugs I taught you yesterday, right? We gonna give antibiotics. Any question? Any question with meningitis? Yes. Widened pulse, low respiration, increased BP. So, yes. I can't, because remember, meningitis. Watch this. Meningitis go into ICP. One of the problems with ICP is respiration. Wait, babe, morphine. You see, it's all about comprendre. Now, let's go on the board and see what y'all can help me with. We clearly told you the disease. We clearly told you signs and symptoms or data collection. I told you nursing intervention. Blood, I talk about it, but we ain't go deep here. I told you the assessment, Kerning, Sign, Brzezinski, right? Blood test, we're going to do WBC because they're going to have a fever, right? We're going to do cultures, high. 4523. Yeah, next room. Okay. Blood test, right? WBC. Lumbar puncture. So we're going to go to lumbar puncture. Machine test. Now, before I go to the machine test is MRI, chest X-ray, before I go there, what test, machine test, you think the doctor will order? Forget about the book. Use our common sense. Meningitis, inflammation of the brain. What test you think the doctor will order for the brain? CT scan. EEG, not EKG. EKG pour care. EEG pour brain. So he gonna order EEG, just talking out loud. He's gonna order lumbar puncture is the blood test because it's the water they gonna check. So we gonna talk about that. So we gonna talk CT scan, lumbar puncture, and EEG. Not only we gonna tell the patient these are the tests they gonna get, but we gotta teach them before you go take the test how to prepare yourself. So let's go to diagnostic tests, right? So we gonna go on page. Don't lose your 830. Keep your pen there. The diagnostic test is going to be on page 810. We're going to do EEG on 810, and then we're going to get the other ones. So EEG, because the doctor going to order 3 tests. EEG, a CT scan, and he gonna order lumbar puncture. We gonna talk about 3 tests. 810 is EEG. And I don't want students say, Miss Sonia said EEG only for meningitis. I never said that. EEG could be for anything has to do with neuro, they can order. MS, MG, myasthenia gravis, doctor order. EEG. Ready? EEG is a graphic recording the electrical activity. So it's like the starter. You know how the starter in your car, right? Now, pre-procedure. Me teaching you. They go to teaching. Sonia gonna do an EEG tomorrow. Teach me, nurse, what I must do. Ready? Sonia, wash your hair. Nurse Kawal, do I need a consent? No. Because this is not what? Invasive. What they gonna do, they gonna put electrodes on my head. How they gonna stick? There's a little cream they put. So Sonia, that means, Sonia, you cannot put hair grease in your hair because they're going to put a little glass. If somebody put it look like Vaseline to stick, to keep the electrodes on. Oh, Sonia, coffee. Don't drink no coffee, Sonia. You see that? Don't drink no tea. Don't smoke because coffee, tea, smoking got caffeine in it. What about chocolate? Caffeine. Do you see where NCLEX can come with you? The key is for you not to memorize. The patient cannot have coffee, tea, and smoke. The key is for you to know that the patient cannot have caffeine. So NCLEX can changer étiquette however they want. It's to comprendre. It's not about you memorizing coffee, tea, caffeine, period. So anything that have caffeine, they cannot have. Mint have caffeine, coffee, tea, chocolate, soda. The people don't have to put these. They can put a peppermint. So super because it's not about you memorizing. You got it, guys? Okay, so you speaking to me, you teaching. You cannot eat these, right? Ooh, antidepressant. Zoloft. So NCLEX go like this. The patient is scheduled for EEG. Which drug would you question? Bon, super antidepressant, yo. Me wuloa. When you get to psych, I will teach you other antidepressant drug. You see that? Tranquilizers and possibly seizure medication has to be held. What teaching? Kawal, you cannot take your seizure medication for 24 to 48 hours. Can I eat? Yes, the patient can eat. Okay? Post-procedure, wash the hair. Why are you going to wash the hair before and after? Because after is to remove the grease. Before is to make sure you don't have grease so it can stick. Okay, there you go. When I do an EEG, I'm going to force you to have a seizure. I'm going to make you do this. I'm going to try to initiate seizures. That's why anytime a patient having an EEG, you must put the side rail up. The patient cannot drive. They must have a driver. You know why? Because when you do EEG is the #1 test for seizures, but they also do it for other stuff. You are initiating. Initiating means a first seizure happen. So you must initiate seizure precaution. In the EEG room, there's embu bag, there's trach, there's a board. Why? Because airway is priority, because we are initiating seizure. Any question? Okay, scratch EEG. Now, continue more diagnostic tests, right? We're gonna go into lumbar puncture first on page 809. So you guys, you see why when a student, papa say, kote mti ni mo, and très fâché, because it's not about the money. Trust me, I know where to go make money. I get so mad on class nou fait, so pretty, nice. For a student don't bring license, if you do devant ou parler cause because I do the class too pretty for you to go in the people test, don't bring the license back. I want for them family to I work too hard for you. It's not about your money for you to go on the test. It's no good. Because you should stay CNA. Class la trop belle pour pote gagot. That means the class is too nice for you not to pass. Right, Susan? Mm-hmm. Okay. That's right. Let's go. Susan don't speak Creole, so I got to translate. Let's go. Now, lumbar puncture. In your career, you will never do a lumbar puncture. Not you. They got special people to do it. But you need to know how to position the patient. You need to know pre, post, doing. You understand? Not that you need to do it, but you need to know what to look for while the patient doing it. Guys, listen. When you are a nurse, she a respiratory therapist, I'm the nurse. My patient has COPD, so my patient has to go see a respiratory therapist. I'm on top of the respiratory therapist. Do y'all know that? Okay, because some students go, well, respiratory therapy, you are specialized in one thing. I am specialized the whole body as the registered nurse. So just because you're going to go see somebody to do a lumbar puncture, if the color of the spinal fluid is green, it's my job to report it, not the specialist. Do you got that? Mm-hmm. So the one the students say, but the specialist came, they should take your license away because you don't know your value. You are the top dog, and the specialists come under you. You got that? Huh. Make sure you know your value. I don't care if you LPN, you RN, you still over. Even the LPN is over the respiratory therapist. Because you looking at the patient as a whole. You got it? Okay. Ready? Lumbar puncture. NCLEX asks you where they're going to put the needle. First of all, we're going to have a needle. So you're going to need a consent because that's invasive. Between L3, L4, highlighted. And guys, anytime you go to NCLEX, your mando, where you going to stick the needle, you just failed that damn test. You know that. Where are you going to stick the needle? Level 1. Level 1. After you stuck the needle, the fluid is green. What do you do? Level 3. But where you going to stick the needle? The book told you L3, L4. That's a level 1. You know you just failed. Because NCLEX, any level 1, you need 265 level 1. And you need 75 of level 3, which is critical thinking. Where you going to stick the needle? Well, hell, it's in the book. L3, L4. Right? Now, number 2, the test is contraindicated. You know what that means? Who cannot have this test? ICP. Listen, before you say, Miss Sonia, say. When you have meningitis, you can do the test. But once the meningitis go to ICP, you cannot do lumbar puncture. Any questions? All right. Before you say, I say. Right? Now, the test is contraindicated in client with ICP because the procedure will cause rapid decrease in pressure. Pre-procedure, before consent. Have the client empty bladder. You know why? Because they stick in a needle. Suppose the needle rupture my bladder. That's why you got to make sure you say, Kawal, can you go use the bathroom before? So consent, empty bladder. Doing the procedure, doing now, position the client lateral. Why? Where's lateral? Side. They go NCLEX with their English. Lateral. Recover. Knee to chest. Or they give you 4 pictures. They can do whatever they want with you. Photo or the words. You see? So I don't want you to say, but the books say lateral. Let's find other names beside lateral. Side. Right? Fetal. What are more English? Recumbent. Okay? Now, that is doing. Right? Now, assist with the collection of specimen. Boy, where do you get the specimen? At the bedside. Where do you label it? At the bedside. You see where the questions can come? Because you don't want to go mix the patient. Right? Maintain strict asepsis. That means when you labeling it, you must wear gloves. So they go NCLEX. Which one will you intervene? When you see the nurse doing the lumbar puncture without what? Gloves. You see that? Or even labeling it without what? Glove. Post-procedure, monitor for vital signs. Hey, why must I check vital sign and neuro check after lumbar puncture? Hey, it put the disease in too now to see if it progressed to ICP. Now the whole time, right, I'm going to position the patient after you do the lumbar puncture. Let's do that, right? Position the client flat. Why? To put, wait a minute. See, there you go. You know why you say put pressure? Because the school told you to damn say pressure. Wrong. Listen, why would you put an aiguille here, and I ask you why you lay me flat, you say put pressure. If I want to put pressure, right, I'm going to put them on the side. So again, why do you put pressure? Why do you lay them flat? Whoa. CSF affects with balance. So the reason you put in the patient flat, parce que patient ka tout dit, the patient dizzy, CSF has to do with spinal cord. So guys, If you want to put me for pressure, you're going to put me on my side and put a Band-Aid. You put the patient flat, one, to help with the CSF to balance the fluid, one, and also help with the headache, drowsiness you're going to see the patient have. Because CSF